week on Health Affair, your program of choice, we'll be focusing on some neglected tropical diseases in series. We'll begin with tuberculosis. I remain your regular anchor, Ushuomo Wadanis, and you're welcome. For a reminder, Health Affair is a platform where we focus on public health challenges, issues about women and children, with the sole aim of providing lasting solutions. Let's take you through our new segment for a start.
As Nigeria joins the rest of the world to mark 2023 World Malaria Day, public health experts have called for all hands to be on deck to make the country free of malaria. While a few African countries like Tunisia, Libya, Mauritius, Algeria, and Lesotho have been certified malaria-free, Nigeria still records about 300,000 deaths annually.
Over 96% of death rates are being caused by this particular disease in this same region. Also, children under the age of 5 accounted for about 80% of all malaria deaths in this region.
Every question that you will ask about Nigeria, there's a solution. There's viable answers and feasible answers on papers. But the problem is implementation. What is our health indices in this country today? Mortality rates, morbidity rates, lifetime expectancy, and all this stuff. Where are we as a country? Nigeria is the giant of Africa, but sorry to say that it's a sleeping giant, if not a crawling giant. We take one step forward and 2 steps backwards.
Speakers also reacted to the newly approved malaria vaccine by the National Agency for Foods, Drugs Administration and Control, NAFDAC.
NAFDAC has done due process, reviewed those results, and I also believe results from WHO before they decided on approving it. So for 2 reasons, we need it, and secondly, it's been tested in Africans.
Malaria Day is celebrated 25th of April every year to highlight the need for continued investment as well as sustained commitment to the prevention of malaria and its control. The theme for the 2023 celebration is Time to Deliver Zero Malaria, Invest, Innovate, and Implement. Human needs are always on the increase, and since people are not able to meet all their needs, service organizations like Lions Club are ever willing to intervene. The need to add value to society after a need assessment necessitated the renovation of Ojota Senior Secondary School Teachers Staff Room, the provision of pipe-borne water for residents of Araromi Street in Ogodo area of Lagos State, and signage at the Ojota Chemical Market by Lion Sandra Adebola and her team at the Lagos Apex Lions Club.
It's a great privilege for us to be able to be the one to do this kind of a thing for the community, and particularly to Ojota Senior Secondary School. And I'm very happy because we are seeing smiles on the teachers' face that we have made their staff room to be conducive for them.
And you can see for yourself that this is a very nice office. Our advice to the generality of our community members is that each and every one of us should also try to see how we can partner or join an association like Lions Club International, where we already have a very global platform for us to pull resources together to serve humanity.
This project, fantastic indeed. Fantastic. I'm very proud of you people, and I thank God today. Thank you very much indeed for the cooperation of the Lions Club. We will continue to support them. This is a great Janjati something. It is money of individuals, and we won't disappoint the Apex Club. We won't disappoint them.
Chartered in July 2013, successive leaders have contributed in no small measures to advance the club that has impacted the society in so many ways.
We do projects in different places, in schools, in hospitals, to serve humanity. So be expecting us, we are still going to do more than this.
Welcome back. Nigeria ranks 6th among the first 30 countries with high burden of tuberculosis globally and first in Africa. Despite this high burden, low awareness creation on tuberculosis has been identified as one of the major causes of low tuberculosis case finding in the country, the misconceptions and stigmatization. In this special report you're about to watch, we'll take you through the tuberculosis situation in Nigeria, the implications, challenges, and way forward.
Got a call from my team officers in Lagos, in Adamawa, that 10 patients were diagnosed to have extensive resistance TB. Why must we have 10 cases that are having extensive resistance TB?
Shuaibu Al-Hassan is a pharmacist and one of the public health workers at the Federal Ministry of Health, Abuja, handling tuberculosis, leprosy, and brutal ulcer diseases. He received a call in my presence of about 10 people who were being diagnosed of drug-resistant tuberculosis from Adamawa State. The call got him worried.
When somebody has STI, it means he has defied the use of all the common anti-TB medicines. It's therefore the last point of the TB management. So for 10 patients to be diagnosed at the same time is something that is worrying the program, worrying all the stakeholders of the TB management team. It's not a good one, and we don't want it, because SDR is a kind of the ultimate, is the last point of management of TB. Beyond that, we will not get any drugs that can manage that patient again. Beyond that, the patient is something. Anyway, we have medicine for the management of those cases, but we don't want to reach that level of managing the extreme. We want to manage the cases right from when it's at the onset of the case. When you get to the last stage, that is where it became more dangerous and more difficult to manage. And we don't want to reach that level with any patient at all.
Drug-resistant TB or multi-drug-resistant TB occurs when the bacteria that causes tuberculosis becomes resistant to the drugs being used for treatment, putting the survival of patients at a greater risk. Whether drug-resistant tuberculosis or the regular tuberculosis, the upsurge in cases and unimpressive rating of Nigeria being 6th in the world and 1st in Africa, according to the Director and National Coordinator, National Tuberculosis, Leprosy and Brutal Ulcer Control, Dr. Chukwuma Anyaike, is likened to Nigeria sitting upon a keg of gunpowder waiting to explode.
The data we are having shows that on a yearly basis, we have 444,000 new cases, people being infected newly, not old ones, being infected newly. Now you ask me, where are they? Those ones are in the communities, in the urban slums, in hard-to-reach areas.
Tuberculosis is a potentially serious infectious bacterial disease that mainly affects the lungs, and the bacteria that causes TB are spread when an infected person coughs or sneezes.
It does not respect your age, does not respect your sex, does not respect your social class. Tuberculosis is one of the deadliest bacterial infection. I say this because it disorganizes the system. If you are a breadwinner in your family and you can't go to work, you don't have the strength, of course it has a ripple effect. 2, it can kill you, can collapse your lung, it can even be spread to other parts of the body. That's why we have extrapulmonary tuberculosis. So anything that has to do with your lungs shouldn't be joked with. So it's a highly infectious disease, and we must be very careful in trying to make sure that it does not kill Nigerians. Common symptoms of tuberculosis: weight loss, fever that may not be high grade, weakness of the body, loss of appetite, and cough that has lasted for more than 2 weeks. You go and seek for help. Most of the times, People wake up in the night sweating, even when the environment, the weather is not hot. Weight loss, low-grade fever, cough, and sweating in the night. Of course, to come with other symptoms, depending on the organ, because we have the ones that have gone beyond the lungs. We call them extrapulmonary tuberculosis. So, but these are the classical ones. Once you have it, you go for check.
Tuberculosis is partly preventable by vaccine. The federal government of Nigeria is also offering free tests and treatment for tuberculosis, but not many people are coming out to take advantage of this opportunity.
The government is doing a lot. The tuberculosis test and the treatment, they're free, including the treatment prevention for those that are in contact with the patient that is being treated for tuberculosis, including people that are HIV positive, and we want to prevent them from coming down with tuberculosis because their immunity is low. The government is providing free medicine for all this. But however, the uptake is not enough. So we need the media to educate the people so that they understand what to do, they know where to access care. And we also have, the government has also put in place a toll-free number, 3340, that people can call and ask questions, ask for direction. So all these things the government has put in place, but our people are not accessing it. In addition, the funding is a problem. We don't have enough. So we need the media to be able to, articulate the issues and help our stakeholders, the key decision maker to understand what the issues are and also provide funding. What you don't know, sometimes it becomes a mystery, and there is this wrong perception that maybe it's God that is punishing them, maybe it's witchcraft, maybe it's some other problem, and they start running helter-skelter. So as the National TB program is talking with the media personnel, they are also talking with religious leaders so that they understand that even when you are prayed for this person, that tell the person to still get medication, go to their facility, do the appropriate testing. So while the person is taking the medication, you can continue praying for the person. That way our people can receive the care they need. Some people, when they start the treatment, they start feeling better. The treatment for tuberculosis is minimum of 6 months. So, but by the time you start taking the treatment for like 2 weeks, 3 weeks, the person start feeling better. So they may start doubting maybe it's not actually TB. But by the time the disease will come back, it will come back in a worse scenario. And in the end, sometimes the family will hide the members of the family that has the disease because they are ashamed. There's nothing to be ashamed of. Tuberculosis is completely curable, but the medication has to be taken for minimum of 6 months. And it is the medical people that will certify that you are cured. So the fact that you feel well does not mean that you are okay. For instance, recently in Lagos, in just a school outreach, a child was discovered to have drug-resistant tuberculosis. He must have caught it from somewhere. But the person that was carrying it was not that ill, was not bedridden. That is why our people are not being sensitive to it. By the time the sickness will now start, it becomes a big deal. They are hospitalized and all that.
The TB anywhere is TB everywhere. TB is in the air. So to say it's not my portion is a wish, and we hope it's not going to be the portion of any one of us. However, we live in the world and we need to be very realistic. So anyone can have TB. But TB is not a death sentence. Number one, it is preventable, it is curable, and the treatment and diagnosis, are free. It is very dangerous, very, very dangerous to start TB treatment and not complete it, because it will make the bacteria to mutate and come back in a very strong way, which we call drug resistant. And with drug resistant, the treatment is more expensive, it is more painful, it is longer, and it also has some other side effects. So I will kindly implore those who have TB, please, you can quickly get treated, complete your treatment, and you can be free of TB. And if you already started TB treatment, please make sure you complete it. This is the only way that you can be assured that you have been completely cured.
We realize that stigmatization and discrimination is very much entrenched in the community. Even you see the patient himself stigmatizing herself or himself, health workers stigmatizing fellow health workers. So it's very strong. And the only way that can be removed is when we let people know that tuberculosis is not a disease caused as a result of any sin. It's because there are so many misconceptions going around in our community. Tuberculosis is like any other disease. If people could own up to have diabetes, if people could own up to be hypertensive, so why don't they own up to say that they have tuberculosis and even seek for help, which we all know that both the diagnosis and the treatment are all free.
Of course, everything has to do with leadership. Until Dr. Chukuma Ayake came here, little has been said about the fight against TB. So, leadership is important, and that is what we are missing in Nigeria. What he's doing now, sensitizing the media, will help people to know about the gravity of what we are facing in this country. According to him, if a child, a pupil in a primary school or nursery school is infected, that child, that pupil has the capacity of infecting another 15. And those 15 has the capacity of infecting more other people. And from the data they've given, we have about 400,000 new cases. So we are in serious trouble, and it is only by reaching out to those who can help, and I believe that the media can help.
There needs to be more searchlight on rural communities and hard to reach areas, because in most of the rural communities, where a lot of them are not even educated, they don't really know, they don't keep to the trend of what is happening. So a lot of them don't even know that tuberculosis is on the rise. Yes, at times the problem happens with the funding, going to these rural communities and all that. But as a person, if you can do it on your own as a human angle story, even if it's one person, go to the community, talk to a survivor, talk to a patient, let people understand the gravity of what we are dealing with. I think it will help us to even look at more cases.
We need to begin to make people understand the need to begin to, good health-seeking behaviors. I mean, most of us, when we get ill, we either do self-medication, or some of us, we either say it's from our village people, so they want to go and see prophet, or to see babalawo and all those kinds of things. Now, those things will only make it worse. So for tuberculosis is endemic. I mean, we are missing a lot of cases in the country, and so it's important that we begin to, all stakeholders need to put all hands on deck. From the Federal Ministry of Health to the partners and everybody, they need to, even at the state level, to the local government level, we need to begin to go to the communities, especially where these things are, begin to get these cases, because until we get these cases, one person, as they say, can infect between 10 to 15 persons in one day. So imagine that we have over 3,000 missing cases. So you can do the calculation.
There's so much the media can do actually for tuberculosis, to help the fight in Nigeria. And from my belief, I believe the media is actually the missing link between all of those undetected cases and the success that needs to be, reached for the TB fight, because there's so much money, there's so much work the doctors are doing, so many implementing partners are on the field and, doing what they have to do. But many more people do not know what, there is for them to benefit from. Tuberculosis is free, but how many people know it, So for me, I think the media has begun a good work so far, and for what the media needs to do is more human angle stories, take your cameras, take your microphones to the real issues, the real places, so that people would understand that this tuberculosis we're talking about is not an ancient disease, not an alien disease for a particular group of people. Like people think, they say tuberculosis is a poor man's disease, but it's not the truth. If a poor man, forgive me, but if you think your driver, for instance, is a poor man, your driver is driving a big man, and he's in the AC car with you, you're prone to it, you're exposed to it. If you think it's your maid is exposed to your children go to school, they have teachers, they have non-academic staff, who they're exposed to. So it just goes around and comes around, and people really never take it serious. Tuberculosis is really, really the pandemic, much more than COVID as we think. If you want to put it physically or graphically, they say tuberculosis kills about 157,000 people in a year. That's about 3 air crashes in a year. Do you understand? So imagine that Nigeria had 3 air crashes in a year. You would make that headline news, right? But here it is killing people, and it's not being made headline news because people don't understand the gravity of what it is.
The burden of TB in Nigeria is further being compounded by the COVID-19 pandemic and HIV/AIDS.
You cannot control HIV without TB, you cannot control TB without HIV. And that's still because of the relationship between them. Because someone has HIV and then TB comes up as an opportunistic infection, leads to death. You have not done it, even if you have done everything to cure that HIV or to manage, let's say manage, since HIV cannot cure, you have done everything to manage that HIV. Without paying attention to the TB will come in and eventually lead to the death of that patient. So there is no how HIV can be managed without TB. And TB, on the other hand, someone with TB already, suffering from TB, can still get HIV. So they are both related, one way or the other. So they have to be taken as a syndemic that they are. That is, both of them are related. So they have to be tackled together in order for us to have any reasonable, better health outcome for the clients. The WHO has laid down goals to achieve collaborative activities. So, and it's geared towards, first of all, having a joint platform, coordinating platform. That is, if you want to talk about TB, HIV, you should have one single platform, one single body that consists of both HIV, stakeholders in HIV and TB, so that they can do joint planning. Any planning that they have to do for HIV, TB should be carried along. Then we should take steps towards reducing the burden of HIV amongst TB clients in such a way that every TB patient that comes should be tested for HIV, so that if the person is positive, we know on time, we start care on time, and then health outcome is better. Vice versa also for those that have HIV, at every ARC center, at every visit of a HIV client to the ARC center, he should be symptomatically screened for TB, so that if this is present, it's detected early, treatment is instituted early, and then the client can have a better health outcome.
According to a World Health Organization 2017 global report, 18 Nigerians die of tuberculosis every hour, and the country accounts for over 15% of the global gaps in TB case notification. It has been observed that due to low awareness creation on TB, many people in most communities still have misconceptions which have fueled discrimination and stigmatization, thereby preventing people from coming out to test for TB and access free treatment. To change this narrative, stakeholders are calling for all hands to be on deck, especially the media. Just joining us, it's Health Affair on AIT. Please follow us up on the series as we take you through childhood tuberculosis on the next edition of the program. Now let's take you to our nutrition segment, where we'll give you information about fruits and food items and their nutritional value to enable you make healthy choices.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folate content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Don't forget to support the program by advertising your health products and services with us. My name is Oshua Mowa Daniels. Thanks for staying tuned. Please join us same time next week for another interesting edition of the program. Please keep staying safe.